before we start, Ishan sir, we would like to know, something about you and your podcast.
Excellent. Thank you so much, Abhinandan and Visual, for your introduction. So, about my podcast, my name is Ishan Ankit, and I'm a student of international relations as well. So, it's really inspiring that the younger generation is also drawn towards the field of international relations. So, it is a very interesting field. There's a lot to explore. So, if you are interested in humanities and politics, then why restrict yourself to to the domestic confines of India? Why not broaden your horizon and go international, right? Especially in a time where everything is globalized. So anyway, speaking of my podcast, my podcast is called TwoSense with Ishan, and most of my episodes are conversations with people who have made an immense contribution in the field of humanities. So that is not only in academia, but in the public domain as well. So authors, journalists, filmmakers, documentary makers, all of those people. So I like to invite them over and have a conversation with them and talk about relevant and contemporary stuff. And mostly, I like to offer my own comments on political issues that have recently marred the country. And my most recent episode was on the Farms Bill, and seeing the controversy surrounding the Farms Bill, I thought to myself that why not shoot a podcast about it and put it out there for the for the world, and let's see how the public responds. And I was actually overwhelmed by the response, and yeah, so it's the response is the feedback from my listeners that keeps me going, and I hope to make more such interesting podcasts for all of you guys. Thank you.
Exactly, sir. And even, sir, like I and Visual also do a lot of, co-curricular activities like the Model United Nations and the Youth Parliament, where we also come in contact and, coordinate with the other members who are, willing to discuss similar issues. And if we
Right.
talk about this organization also, the Conflux Rivista, this is a student-run platform. And even we also organize sessions with authors, journalists, and eminent personalities who are working for the betterment and the upliftment of the society. And sir, before we move forward, we would also like to know that from where did you get the inspiration to start your own podcast?
Okay, so my answer may not be as fascinating, if not meet your expectations. So the inspiration strictly comes from boredom from being in a lockdown owing to the coronavirus pandemic. So the thought of the idea of starting my own podcast has crossed my mind a number of times, but then my commitments to studies, to family, and to other engagements always, sort of deterred me from taking this seriously. So yeah, this lockdown, I found that I have a lot of time on my hands and I could use it productively. And then I thought, you know what, why not go ahead with this? I've been thinking about it for a long time anyway. So that basically that was the inspiration, and it's obviously backed up by my interest and my fascination with news, with politics, with contemporary social affairs. So yeah, these are the two
Exactly.
driving forces. Uh-huh.
Exactly. Thank you so much, Ishan sir. And sir, I would also like to listen to some of your podcasts because I believe that it's very informative to listen to podcasts that are encouraging us on such important issues like the farmer bills, as you said. So, sir, where can we listen to your podcast? Like, are they available on Spotify or some other application?
Yes, it's available on Pocket Cast, it's available on Anchor, and it's also available on Spotify.
Okay, okay. Thank you so much, Ishan sir. So
Yeah,
I believe that most of the viewers and even I would also listen to your podcast later today
thank
or
you.
some other day. Yeah.
Thank you.
And
That's
sir,
flattering.
thank you so much, sir. And now, sir, I believe that we should start with the main agenda of today's webinar, that is surrounding the COVID issue and the vaccines that are going to come in India pretty soon right now.
Mhm.
So, Visual, I guess you can start with the questions and then we can have a discussion on the same.
Right. So, Ishan sir, we'll start with a very basic question when we talk about the COVID vaccines. Then, what types of vaccines, COVID-19 vaccines, are being tested? I'm really curious to know because I don't know much about the types of the vaccines because I guess it somewhat depends upon the virus. So, what are the
Mhm.
types of vaccines that are being tested?
Yes, so about types of vaccines, so we have a number of contenders within India and then a number of pharmaceutical companies developing their vaccines outside of India as well. And so far, as per news reports, three of these contenders seem to top the charts. That is one by the company known as, it's a British pharmaceutical company known as AstraZeneca. Then there's Pfizer, there's Moderna, and then there's one more, there's Sputnik 5, which is the Russian COVID vaccine contender. So about the type of vaccine, so basically it's not, you know, I can't say much about the type of vaccine because I don't know the medical details of it. All I know is that all of these vaccines differ, in the way that they can be transported and finally administered to the people. For example, if you look at the Sputnik 5 vaccine, which is Russia's top contender for the coronavirus vaccine, Sputnik 5 requires to be stored at a sub-zero temperature between -50 and -70 degrees Celsius. So that is huge. And unfortunately, that is not feasible for India because we do not have a great cold chain infrastructure. Right. So, which is why, for if we talk about India, AstraZeneca's contender is a much more feasible choice because AstraZeneca vaccine only has to be stored in normal refrigerator temperatures, that is between 2 to 8 degrees Celsius. So it's not even sub-zero. And then India's own indigenous vaccine, the Covaxin, that is being developed by Bharat Biotech Limited in partnership with the Indian Council of Medical Research. They're also conducting their phase 3 trials and they expect to be rolling out their vaccines by January end or the first few weeks of February. And the Indian vaccine is being produced keeping in mind the logistics behind transporting the vaccine. So with the current cold chain facilities that we have, with the current infrastructure that we have, with the number of people who form the population of this country, how do you roll these vaccines out and finally administer it to the people? So I think that's what's more important over here in this discussion is to try and understand how these vaccine contenders, whether they're being developed within India, whether they are being bought from pharmaceutical companies outside of India. The question is, how quickly can you get that vaccine into the country and then roll it out? And fortunately enough, a number of these vaccines are being manufactured within India itself. So Bharat Biotech is developing the indigenous Covaxin. Serum Institute of India at Pune is manufacturing the Pfizer vaccine. They're manufacturing the AstraZeneca vaccine. AstraZeneca's vaccine is the vaccine in partnership with Oxford University, and AstraZeneca is a British company. So we also have another pharmaceutical company called Cadila, who are based out of Hyderabad, and they have only yet commenced the phase 2 trials, if I recall correctly, and they should complete their phase 3 trials by mid 2021, and then we can expect that the Cadila vaccine comes out as well. AstraZeneca, however, is the leading choice for India. And India has ordered 1 billion doses of the AstraZeneca vaccine simply because, like I said, because if you look at logistics, it's very easy to transport a vaccine that only requires to be stored between temperatures of 2 degrees to 8 degrees centigrade.
Absolutely, sir. Because I was also thinking the same. The Pfizer vaccines also requires a minimum of -70 degrees Celsius, and that is really difficult for a country like India, especially in these times when there is economic crunch as well. Right. Absolutely right. So, Ishan, sir, I was also wondering that even if we develop the vaccine in India, or maybe we transport it from another country in partnership with the company or something like that, but then we are watching that the distribution of the vaccine has to be started first of all, obviously, for the corona warriors, but then from the ground level basis. So what the people are doing is that the government is applying some specific stickers, if I'm not wrong, to the houses which are more vulnerable to the vaccines. So how far do you agree that the system which the government is creating in order to distribute the vaccines would be feasible for the country?
Okay, so I think the fact that the government was, placing stickers on people's households who are at most risk of contracting the coronavirus was just speculation and conjecture. It was backed by no evidence. No official report or official statement was ever given by the government, stating clearly that they're going to be pasting stickers. However, just today, this afternoon, the government of India has issued the vaccination drive guidelines in India, and it says that the COVID-19 vaccine will be offered first to healthcare workers, which makes sense, frontline workers like your army personnel, police forces, any other emergency services, and persons above 50 years of age, because these three groups of people are the most vulnerable, right? So each session will be planned for only 100 beneficiaries per day. These are the guidelines that the government of India has released just this morning. And in their guidelines, they also mention that this will be facilitated by a system called the COVID Vaccine Intelligence Network. So, what is this COVID Vaccine Intelligence Network? It's basically a digitalized platform that is going to be used to track enlisted beneficiaries for the vaccination. So, how are beneficiaries, going to register for the vaccination drive? So, at the vaccination site, only pre-registered beneficiaries will be vaccinated anyway. Like, you cannot just walk into a vaccination center and hope to be registered on the spot and get your vaccine and then come out. You have to register yourself prior. Only when your registration is approved will you be able to go to one of these facilities where the vaccines are being administered. So, in order to register for this for the vaccination drive, you have to have at least 12 documents, which I think is taking it a little bit above the top, because and these include Aadhaar card, PAN card, your driving license, passport, whatever you have. So these are 12 photo identity documents that are required. This includes voter ID, Aadhaar card, driving license, passport, and pension documents. This is for self-registration on the CoWIN website. And so I think that's pretty challenging, because not a lot of people in this country, for example, have passports, because not a lot of people in this country think that they will ever, they live to see a day where they can travel outside the country. So I think this is taking it a little bit above the top. And I think the focus of the government is slightly off place. Instead of placing so much focus on the digitalized registration system, the government should focus on how can it facilitate the administering of vaccines for the maximum number of people at minimum time, at the same time as minimizing as much risk as possible. So this will be an optimal approach to commencing the vaccination drive. And I don't think that with the guidelines that have been issued today, I don't think that the government has its focus placed correctly. The focus is strictly laid on the registration process and how people can register, become beneficiaries, and then only to expect that only 100 people will be vaccinated every day in a single district. That I don't think that's a great number, but maybe things will pick up later. We don't know. Let it begin. So these are plans for starting from January 2021. Maybe the government might make some changes to these guidelines and ease out some of these registration processes for people. Yeah.
Exactly, sir.
Mhm.
Right, sir. So I also wanted to know that now the big question about the lockdown, the restrictions that we are facing in the lockdown. So once I have been vaccinated, let's say the vaccine comes, I've been vaccinated against the coronavirus, then will I be exempted from the lockdown restrictions? Are there any clarifications on the same, or is it very subjective to the protocol which the country should follow?
No, see, so I don't think that the government of India or any other such authority with respect to the coronavirus vaccination drive has issued a statement, clearly stating that people who have been vaccinated are exempt from being cautious. I don't think you can be exempt from being cautious, because first of all, we need to understand, although all three clinical trial phases have, been concluded successfully for the vaccines that are going to be rolled out, the time required to monitor the consequential effects of being vaccinated is a long time. Okay, it's between 10 to 30 years. So even if the vaccine is safe to use, to fully get a sense of the consequences it can have on the human biology, it's going to require another 10 to 20 years. So people still have to be cautious about it. Yes, within themselves they can feel a little bit secure that they have been vaccinated, but I don't think it is, it would be a really sensible thing to do to lift, the restrictions, the social distancing restrictions, and all the new norms that now we've gotten acclimatized to owing to the pandemic.
Exactly. And sir, since we were discussing right now the Bharat Biotech and the Serum Institute of India, sir, I also had a question at that time that, sir,
Mhm.
India is said to be one of the largest buyers as well as the leading producers of COVID-19 vaccines. Sir,
That's right.
Yeah. So do you see this as a success of Indian medicine, and is this an indicator that India is slowly excelling in the field of medicine and medical research?
Great question, Abhinandan. So although whatever you said is absolutely correct, but this only came into public information after this coronavirus took the world by storm, and India included. Let me tell you that India has been a leading exporter of vaccines for a really long time now, really long time. So, vaccines that come out of Serum Institute of India, for example, account for more than 50% of the global vaccine. The Serum Institute of India has been exporting its vaccines to 160 countries, 160 countries. So, however, not a lot of people knew about that because not a lot of people took interest in matters such as vaccination and anything related to the field of medicine. Only when the coronavirus came into the picture, people have, taken an interest. People's curiosities have been sparked to understand how, India can contribute to the field of medicine. India, for a long time, starting from Arthashastra, and if you look at surgery, surgery was, the first accounts of surgery being practiced was in India in the Vedic times. So India has been a leading contributor in the field of study and practice of medicine for a really long time. So this is nothing new. And yes, and you the second part of your question, I think, was about India progressing in the field of medicine slowly. India is already quite progressed in the field of medicine, and as a matter of fact, Indian medical infrastructure is popular across the world, and there's a phenomenon known as medical tourism. So, medical tourism is when people who suffer an ailment in countries that charge a lot of money to treat that ailment often find it a plausible choice to buy an air ticket, get a visa, come to India, get their treatment done here. So if you go to any of these private medical facilities such as Medanta in Gurgaon or Artemis Hospital Fortis, you'll see a number of international people coming in from Bangladesh, people coming in from the Middle East, people coming in from Africa, because in India, the healthcare system is not only effective but also cheap, and that is huge. India, I think, stands as an example to the world that healthcare does not have to be, you know, extravagantly expensive. Loan out your savings in 5 weeks, and it can be, administered to as many people at a reasonable cost.
Exactly. And sir, as you stated that we can observe people visiting India for medical tourism. So
Hmm.
similar observation, I guess most of us have also made when we, visit hospital for some personal purpose or family reasons. Like I have been to Fortis Noida and I have seen many people, and as far as I got to know, I interacted a bit with them. They said they are from, I guess, Kenya. And as you stated, most of the people from African countries visit India for the purpose of medical tourism only. So yes, sir, I also quite agree on the point that India like has excelled and is keep on excelling in the field of medical research and medicine. And even I also didn't knew the points that you told about, that Serum Institute of India has been exporting vaccines to around more than 100 countries, as you said.
More
So
than
I guess,
150 countries.
yes, sir. So more than 150. And I guess this is a very big achievement for India because
Hmm.
people often criticize that the bills in the Indian private hospital is exorbitantly very high. And I guess uh, these are some very basic points that each and every person should know about the medical infrastructure that we have in our country. So moving forward, I had one more related question to this only.
Hmm.
Sir, do you think that conducting the RT-PCR test at a low cost and giving free vaccines to the people is a depletion of the government fund? And on a fair scale, what is more important? Sir, free and affordable health services to all the people in the country, or the government funds collected through the tax of the common people?
Okay, so I think that's a very challenging question you've thrown in my face, Abhinandan, because I am not inclined to say either of the two options that you've thrown my way is the absolute way to go.
Okay.
Okay, I think a middle ground has to be found. And you raise a very pertinent point in asking if free vaccination you know, is going to contribute to depletion of government funds. See, it's a very it's a gray area. Okay, so it requires a lot of thought and attention to detail to try and understand the full, to try and get a stock of the situation. Okay, so I do not think that it is it's going to contribute to the complete depletion of funds and the waste of tax money, because see, in India we already have free healthcare services, in terms of community healthcare services. In Delhi, you must have seen mohalla clinics, for example. In rural areas, you have free consultation given by doctors. So India has been front runner in terms of providing free medical facilities for a really long time. However, in these places where you can expect to be treated for free or for a very low cost, the facilities do not tend to be up to the mark. Okay, the sanitation, the hygiene, so that I think is quite appalling, seeing that you would expect a medical facility to maintain standards of hygiene. So, and it's very appalling that that is not maintained in all of these public healthcare facilities. Also, speaking about depletion of government funds, see, it's very, if you look at it from the government's perspective, you also have to see that if the government fails to vaccinate, to inoculate a great number of people in a short span of time, the government is going to have to deplete its fund anyway. Look at how much of public fund was lost in the lockdown. This is not just in India, across the world. When we went into a lockdown, didn't the government pull money out of its pool and then help alleviate the economic crisis that we were diving down into? It did, right? So if the government can put the country in a lockdown and then allocate a certain amount of money to try and alleviate the impending economic crisis situation, it can for certain, if not for free, it can certainly offer uh, you know affordable vaccination drives to people of India who might not have, the resources to afford, a vaccine.
Exactly, sir. And I also believe that we three, I, Visual, and you are not in a position to, answer to this question perfectly, because I believe the people who are sitting in the think tanks of the government will, certainly find a middle ground, as you stated, to balance both the situations. Because as we know, at one side, we have a huge population. We are the second most populated in the populated country in the world at 135 crores. But on the other hand, we also see that the poverty levels in our country is one of the highest. So I believe, yeah, exactly, the people who are sitting in the government think tanks will surely find a middle ground to balance out both the situations. And
Yes,
yeah,
I
sir,
agree.
I completely agree with your points.
Thank
Absolutely,
you.
absolutely. I also feel that way because education and healthcare are the two things that should be the backbone of any country, and for that matter, something or other has to be done for the reducing the cost of the vaccine. Right, sir. Further, moving on, sir, I'd like to ask a question. Like we are talking about the phases of the trials, So I'd like to know more about what are the different phases of the clinical trials, like in a bit of detail, as we all know that there are three phases: phase 1, phase 2, and phase 3, which are the studies that they do, the surveys that they do, lakhs of people are involved. Also, what are the phase 3 COVID-19 studies measuring to tell if a vaccine works, whether it is feasible, or in a nutshell, what can be the conclusion of the out of the trials that are being going on?
Great question. So see, generally for most vaccines that are rolled out for administration to people, it requires three phases of trial. However, for the COVID vaccine, the proposed plan is to have 5 stages of trial. So it's not three but five in with respect to the coronavirus. So what are these, stages? So one is the preclinical stage. Preclinical stage is a research intensive stage where people try and brainstorm as to figure out what is the best method to move forward and produce an effective vaccine. So these are the preclinical. So there are two preclinical stages, and then there are three clinical stages. So the three stages that you mentioned would be the clinical stages. In total, there's five, two being preclinical. Okay. So phases one and then two. Phase one is about the brainstorming. It's a research. So you rely on the already existing medical research in place as to try and understand the nature of the virus. What is the trouble that is confronting you at the moment, and then if there is any similar record in medical literature to combat the novel virus. So that's part one of the preclinical stage. Part two is to see how can you make, using the literature that you have at your disposal, how can you make something that is safe and effective for the maximum number of people. See, we can't say that any vaccine is going to be 100% effective. That is not just for the coronavirus vaccine, but any vaccine for that matter. You can't say it's 100% effective because each individual is biologically different, right? So it has its pros and cons. So what the approach is for people in the practice of medicine is to try and achieve maximum, results of the vaccine with minimum side effects and minimum risk. So minimize the risk, maximize the inoculation. So these are phase one and two. So it's all about brainstorming and safety. Phase three is about how effective the vaccine is. So how do you determine how effective the vaccine is? So this is a stage of the clinical trial. So these facilities who develop and manufacture vaccines, they ask for volunteers. So volunteers sign up, they sign contracts with these pharmaceutical companies or any other independent lab for that matter to volunteer for the research, and they're paid a certain amount for it. Okay. So for example, in the case of Johnson and Johnson is a pharmaceutical company based out of the United States. They had a really high number of people sign up for their vaccination program very early in 2020. Why? Because Johnson and Johnson has a fairly good reputation, right? However, the Johnson and Johnson vaccine, as it turns out, seems to have come out as the least effective. So how did you arrive at this conclusion? You arrived at this conclusion because Johnson and Johnson saw most number of people sign up for the as volunteers. So Johnson and Johnson had a huge database to tap into. A great number of people signed up to be volunteers, right? And then a great number of people proved that the Johnson and Johnson vaccine was not very effective, and nobody's talking about Johnson and Johnson with respect to coronavirus vaccines. So similarly, other companies get volunteers. So the greater the number of volunteers, not just number, there's a lot of other factors in place as well. So you have to look at the age. You have to try and achieve a balance in the demographics of your volunteers, as in what are the age brackets. So are they between 18 to 60? Are they kids, are they infants? So it's very, I'm not going to delve into much details, but basically you get the point, right? So it's a number of people from different walks of life, different ages, living, inhabiting different climatic zones. And then you study, you observe every group of people differently. So then we move on to phase four. So phase four is basically about getting the vaccine approved if it's effective and licensing the vaccine. So I don't think that requires any explanation. So once your results are conclusive and you see that the vaccine is good, you apply for licensing. And then once you get the license, then you apply for emergency use authorization if you're facing an emergency, such as in the case of the COVID pandemic. Then we have phase four. Phase four is the long-term study that I was just talking to you about. Okay, so after years of this vaccine, after years of doing a study on the number of people who've been vaccinated, can we come to an objective conclusion as to how safe a vaccine is? So it's a long period of time. We're looking at 10, 20, 30 years in some cases. So it's too soon. All we know as of now with all the vaccines available is that they are safe and effective. But what can be the long-term consequences, the long-term side effects? How is it going to alter a human biology? We will not know for another 10 years at least. So this is, phase four. And phase one is, I conflated two phases in phase one, so I'm going to stop at phase four. So the study research and then the approach is phase one and two. I only said it as phase one. So yeah, so those are your 5 phases of trials: two preclinical and three clinical.
Right. Sir, you are absolutely correct, because the Pfizer vaccines which are tested, which are injected to the people, have the consequences of allergy to a lot of people. So, which is absolutely right. We need a lot of time in order to develop an really efficient vaccine, sir. Right.
Mm.
So further moving on, I'd like to ask that, is there a need to vaccinate every person? Because I feel that the only work for the vaccine is to break the chain. As we know that this is some virus which takes from 1 to 10, 10 to 100, 100 to 1000, 1000 to 10,000, 10,000 lakhs. That's the chain of the virus. So is there a need to vaccinate every person, because the vaccine will only break the chain? So would the vaccine be given to everybody or to a certain amount of people depending upon their vulnerability or the breakage of the chain?
See, again, great question, but I don't think you and I are in a position to comment on whether or not vaccine should be administered to everyone, because at the end of the day, any medical, product cannot be administered to somebody without their consent. Okay, so with the vaccines that are already available on the planet Earth, again, vaccines against the Ebola virus, for example, vaccines against polio, and a number of other vaccines that are already chickenpox, for example. There's already a lot of people who have raised their doubts, and there's an entire anti-vaccine drive that is being talked about in the world in more contemporary times. So people are actually saying that some of these vaccines, some of these regular vaccines that you and I have probably also gotten, has may have something to do with with kids developing, say, autism, or with the brains not developing properly. Sometimes they have issues with their limbs, and people relate it to being vaccinated. So in America, as a matter of fact, most new parents do not want to get their kids vaccinated against any disease. You know, so which again, I think that again, with everything that whenever we have a discourse on medicine, we always have to see that there is going to be risk. Okay, you, if you do anything, if you're going to mess with human biology, you know, there is going to be side effects. Nobody can, another human cannot exactly predict how your body functions. Body is a network of a multitude of things that the human brain is not fully ready to understand or interpret. We don't have the capacity to do that, so we rely on literature, and years of research. And then this research can only be applicable to the extent wherein we can see that, okay, the benefits outweighs the risks, right? However, there are people who might not be drawn to the fact that the benefits outweigh the risk. Even if there is a slight risk, say even if there's a 2% risk, people may not want to take that. So it's absolutely up to people as to whether they want to take a risk or whether they don't want to take a risk. So, coming back to your question, if everybody has to be vaccinated, in my personal opinion, with the coronavirus vaccine, I can't say yet, because I don't think it'll be, very wise of me to comment when the literature itself is not available on how effective and safe the coronavirus. Maybe 10 years down the line, I'll be able to offer better comments, but as of now, I can't offer any comments whether everyone has to be vaccinated. However, I do think that people who are vulnerable, old people, senior citizens, frontline workers, and health workers, they should consider being vaccinated. Again, I wouldn't say they absolutely have to, but I would strongly advise that they do.
Right. Sir, I
Yeah.
get your point. I get your point. Absolutely. Body is something really different. Every individual is human. Every individual human is different in terms of their mindset and in terms of their biological needs and structure. That's absolutely correct. Now, sir, the next question would be the last question from my side. And it's something really precise about the thing. Now, we don't talk about the herd immunity for protection against influenza or any other common viral infections. So why is it discussed so much about the COVID-19 pandemic? Because the herd immunity is something really common for diseases, and but we are not. But in this COVID vaccine, in this COVID times where the vaccine is coming in, the herd immunity is really common, at least as compared to common disease like influenza or other common viral infections. So what could be the main reasons behind the using of this word? Is it something really necessary and important that every individual has to know in order before getting the vaccine, or is it something really subtle?
See, an individual can never know whether an herd immunity has been developed or not. Okay. And speaking of, I think you mentioned something about some viral infections being common. So when you say that some common viral infections, what do you mean exactly? So common viral infections, as in viral infections who affect a great number of people, but do not pose any significant threat to people's life. I,
Yes,
I suppose that's what you mean.
that's
Yeah.
right.
Yeah. So why do these viral infections that we already know and have talked about do not pose a significant threat to human life? It's simply because a herd immunity has been built. That's why you call it the common cold.
Mhm.
Okay. Common cold wasn't so common 1500 years ago. or even 1,000 years ago. Common cold took away lives. The Roman plague, in the Roman plague, great
Yeah,
number of people died of common cold. If you look at some certain tribes of India, like if you look at the North Sentinelese people off the coast of Andaman and Nicobar Islands, they will not be able to survive a common cold. They will not be able to survive anything. So, what is common for us is not common for them. Why? Simply because there is no herd immunity amongst them. Now, why is there no herd immunity amongst them? There is no herd immunity against them because they have never been exposed to this viral infection that you call a common cold. We have been for a long time. So our bodies are used to fighting off the virus. We have an immunity within our bodies that has gotten used to this virus because they have been, affecting human lives for a great number of years, for a really long time. So it's been passed down, the immunity, the ability for the human body to fight off these viruses has been passed down from your great grandfathers to you. So now this coronavirus is novel, right? So why is it novel? Because it has only come to affect the human body very recently. But when you have great grandchildren or their great grandchildren, for them, they probably wouldn't even need to be vaccinated against coronavirus because herd immunity will have been achieved.
Hmm.
Yeah.
Okay.
Mm.
Right. Absolutely right. So yeah, herd immunity is something really specific for diseases to disease, and that too diseases affecting people to people. Right.
Mm.
That's absolutely right.
Right. Thank you so much, Visual. Sir, I have one more question. Sir, that many political parties, sir, this is a very opinion-based question, and I would like really appreciate if you can give your opinion on this question. So that many political parties, like the BJP, especially in the Bihar elections, and the Communist Party in Kerala, sir, have promised free vaccines to the people in their states. And sir, considering the poverty levels in India, sir, do you think that this is a good move, or just a pre-election promise?
I think it's neither. I think it's just playing on people's minds because whether or not who is elected, free vaccines are going to be administered to a number of people in India anyway, because that's just how the medical system in this country works. You do not go to rural areas and expect people to pay the whole amount for vaccines. So government already has a provision in place, irrespective of who forms the government, whether it is the BJP, whether it is the RJD, whether it is the Congress, it doesn't matter, but they say it in their election speeches to make it look like as if they are facilitating it, as if they are making it happen. So whether or not BJP wins the election tomorrow or not, the free vaccines are going to be administered anyway to people who cannot afford it. So that's no question, it doesn't matter who wins, because that is something that is going to be issued by the central government using the infrastructure that is already in place within this country to be able to offer healthcare services to people who may not be able to afford it for free.
Exactly, sir. And I also believe that, this is a very good tactic to influence a mass voter base, because right now, each and every person, irrespective of how well educated he or she is, everyone knows about the coronavirus and expecting a COVID vaccine as soon as possible, because all of our lives have come to an halt. And even I believe that, and from our experience also, we know that if someone requires medical treatment and a vaccine for a great disease like coronavirus, the government at any given point of time won't refuse from giving a vaccine to that particular person, right? And sir, with this we come to an end of the questions that Visual and I had. And Paki ma'am, we would request you to now take the floor.
Thank you so much, Abhinandan. With this, we come to the end of this particular session. I am sorry, my camera isn't working, I guess. Yes. So I am very apologetic about that. But thank you, Ishan, for joining us today. Thank you, Visual. Thank you, Abhinandan. You did a great job. I hope you had a great session with us, Ishan. We look forward to have you once again on our board. Thank you.
Thank you so much, Paki. It was indeed a pleasure, and thank you so much, Visual and Abhinandan. You guys have been it's been a pleasure conversing with you, and hope to see you again soon. And thank you everybody else for attending. And I'm glad that I've had a number of people come and listen to me talk. So thank you so much. See you soon. Make sure to check out my podcast. See you.
Surely, sir.
Sure,
Pleasure.
sir. Sure, sir. Sure.
Yeah.
Thank you so much,
All
Ishan,
right.
sir. And
Thank
we
you. Good
also
day.
got to learn about many things about the COVID vaccine.
Thank you. It's been a pleasure. Thank you. Have a good day. Bye bye.
Thank you so much, sir. Thank you.